Wollondilly.
Thank you. Bowral and District Hospital serves the community in a wide area of the Wollondilly Electorate, including the Shires of both Wollondilly and Wingecarribee, but it also treats patients from surrounding areas as well as interstate and overseas visitors. The hospital has a capital works budget of $55 million in the last 3 years' state budgets for Stage 2 of its redevelopment. This hospital also has an advocacy group that is second to none in this state. To this end, I thank and recognise the work of Edna, Carmichael and Peter Edwards of Public Health First for their ongoing work in advocacy. The Stage 2 upgrade for Bowral Hospital, promised initially under the former member of Wollondilly, Rowell, has been announced over and over again, but there is little physical evidence of redevelopment since Stage 1 was opened in 2020. The community has been told that a new sterilising unit and a pharmacy in Stage 2 had been completed. These are inside the Stage 1 building, but have been funded out of the $55 million Stage 2 budget. The community has already expressed its concerns about what is happening at Bowral Hospital. The renal dialysis unit opened last year inside the former children's ward of the old hospital, and that's a good example of the concerns raised. That unit was principally funded with $750,000 raised by the community for the renal services equipment, but located in a refurbished area at minimal cost to New South Wales Health. Nevertheless, claimed as a Stage 2 achievement by the former government and by the local health district. This funding and the gathering of support by the community was under the assumption of the original Stage 2 redevelopment, which would see an increase in bed numbers. Stage 2 of Bowral's hospital redevelopment was identified in the clinical services plans in 2015 and 2017 as requiring 129 beds, which for the next 2.5 years. The clinical services plan also projects that the need for beds by 2031 will be 142. I and the community waited for bated breath for how this will be achieved. There was a shortfall of 15 beds in Stage 1, even in its opening in December 2020, and there are only 94 of the planned 109 beds. So the planning target now should be 50 additional beds to deliver the planned 142 beds in 2031. This is without the staggering growth projections in the southern part of Wollondilly and Wingecarribee Shire. Bowral and District Hospital serves the community across all of those areas, and 3/4 of the patients come from other areas. The planned growth is going to go to nearly 71,000, an increase of 35.6% in Wingecarribee, and an even greater population increase of 73.6% in Wollondilly. Much of this to be delivered at a swipe of a pen by the previous planning minister and the former New South Wales state government. But there is no increase in beds or clinical services evident in the announced Stage 2 of Bowral Hospital to match this population explosion. Planning has not progressed beyond 2031, 10 years sooner than the current planning horizon of both the local council and the Department of Planning. And the current announced Stage 2 project has no additional beds or clinical services to address that target. The Southern Highlands community has been shortchanged by the announcement of this so-called redevelopment, which amounts only to refurbishment of old buildings and relocation of existing health services, hospital administration, a loading dock and a mortuary. An unattributed media release from the Southwestern Sydney Local Health District on 24th of May 2023 stated the scope of Bowral and the District Hospital redevelopment stages 1 and 2 remains largely unchanged since their 2018 approval, with a continued focus on expanding clinical services and capacity to meet the future healthcare needs of the community. The media release also says that the hospital's clinical services plan, including estimated bed numbers and service provision, is regularly revised to ensure that the care meets the needs of the community. Mind you, the only place that you can find this information is on the clinical services plan on the hospital's website, which is currently updated in November 2017. So, Stage 1 has provided modern physical facilities for patient care, but there is still a vast gap in services and corresponding facilities at Bowral Hospital that should now be addressed to develop Stage 2 of the master plan that has apparently seemed to be discarded and abandoned in favour of retaining existing old hospital buildings that will stand in the way and prevent future expansion of the hospital. I call on the government to fulfil the Stage 2 as originally planned and listen to the community, and I look forward to working with the Minister for Health's office on the upgrade. I look forward to also speaking on this matter again with updates and highlighting the needs of my community and the services as they are delivered.
Well, I thank the member for Wollondilly and I call the member for Port